Answer. Question number 10, Scott Simpson.
Thank you, Mr Speaker. My question is to the Minister of Health and asks, what recent reports has he received on improved access to first surgical assessments?
The Honourable Dr Jonathan Coleman.
Mr Speaker, I've received a recent report confirming that over the last 6 years, the number of first surgical assessments has risen from 267,000 a year to 317,000. This increase means that now 50,000 more patients each year are seeing a surgeon for a first assessment than in 2008. That contrasts dramatically with the 8 years prior to 2008, where access to first specialist assessments were actually cut in real terms.
Supplementary question, Scott Simpson.
Thank you, Mr Speaker. To the Minister, has the increase in the number of first surgical assessments resulted in reductions to waiting times?
Mr Speaker.
Honourable Dr Jonathan Coleman.
Mr Speaker, yes, it has led to significant reductions in the time that patients have to wait to see a surgeon. In 2006, there were over 15,000 patients waiting over 6 months for their first surgical assessment. Today, there are now only 2 patients waiting over 6 months and only a small number waiting over 4 months. That's the result of the hard work of our dedicated health workforce and the government's commitment to increasing health funding despite tough times.
Supplementary question, the Honourable Annette King.
How many New Zealanders have received letters in this last year telling them that they can't have a first specialist assessment because they don't reach the threshold set by the DHB, even though they haven't even been seen by a specialist?
Mr Speaker.
Honourable Dr Jonathan Coleman.
Mr Speaker, DHBs have always set thresholds. We're the first government that has ever attempted to count what the member is referring to, and we're in the process of doing that. But what I can say is we are not going to be removing 30,000 people from waiting lists, which happened when Mrs King was the Health Minister.
Question number 11, Annelise Galloway.
Thank you, Mr